Thank you for staying with us. Nigeria is still battling an outbreak of diphtheria, a highly contagious bacterial disease that has claimed many lives across several states. Reports from these states have indicated a steady rise in the number of cases and deaths. The Nigerian government has confirmed with over 7,200 cases of diphtheria have been recorded and about 11,587 suspected cases in 18 states across the country, including the Federal Capital Territory. Without prompt medical intervention, victims can suffer from respiratory distress, heart failure, paralysis, and potentially deaths. Some of the states affected by diphtheria are Kano, Yobe, Katsina, Borno, and 15 others. With this rising issue of diphtheria, the government has set up an emergency task force to curb the spread of the disease and advised parents to ensure that their children are fully vaccinated with the 3 doses of diphtheria antitoxin. Joining us via Zoom is public health physician and health promotion specialist, Dr. Obinna Ibirim. Good morning. Thank you for joining us.
Good morning. I'm happy to be here today.
Right. We see the steady rise in the cases of diphtheria from the last time that we spoke about this outbreak. And it is reported that Kano has a chunk of the numbers, aside Yobe, Katsina, Borno, and 15 others. I am wondering if there are peculiarities within these states that carry a chunk of the numbers that is making these cases spread and rise as we are seeing it.
Yes, rightly said, there are risk factors that are associated with diphtheria disease. And some of those risk factors are one, where you have a lot of unvaccinated children, because when children are vaccinated with the what we call pentavaccine in Nigeria, or the DTP containing vaccine, they are protected against diphtheria and severe form of diphtheria. And also when a lot of the persons in the community are vaccinated and we achieve what we call the herd immunity, the spread of diphtheria in those communities is halted. So one of the risk factors that is associated with diphtheria, and it's common in these areas where you're seeing this outbreak, is that we are now having high number of unvaccinated children. It's just important to point out that Nigeria has about 2.2 million zero-dose children. These are children who are yet to receive their penta vaccines, the first dose of their penta vaccines. And with that huge number of children, you could imagine why we're having such outbreak. The other risk factors are overcrowding and poor sanitary conditions. So when you see communities with such peculiarities, it's not surprising why you're having more outbreak of diphtheria in those communities and in those states.
And what are your thoughts again about the system of vaccination that may be a factor in this rise in cases of diphtheria that we're seeing? How sufficient is it, and how can we leverage upon it now that a task force has been put in place?
So the thing is, the penta vaccine or DTP containing vaccines are valuable in public health facilities. They are given at 6, 10, and 14 weeks to children. But then the problem really is that there's a lot of barriers that prevent children and their caregivers from accessing these vaccines. So this could range from systemic issues. So let's go there before then go back to what is peculiar to these people and the communities that they live. So sometimes you might have a stock out, run out of vaccines, but that's really the major issues are issues in these communities like religious belief, misinformation that is driving misconceptions around vaccines and preventing people from getting these life-saving vaccines.
All right. And now that we have this kind of a problem and Nigeria has put in place a desk, how far would we go in actually resolving these issues? You have mentioned some peculiarities in terms of the fact that there's the religious aspect. You would recall that during COVID, we have this matter of vaccine hesitancy and even resistance. And this is something we have had to struggle with over the years, especially in that area or that region of the country. Dr. Ibrahim, can you hear me? All right.
I think it caught me because I noticed that it sounded rather abrupt. I wasn't sure.
Yeah, so we will be expecting to have him as soon as possible, because these issues that he has mentioned, talking about religion, matter of vaccine hesitancy, was also a matter we struggled with during COVID-19. Even before COVID-19, we have had issues of vaccine hesitancy and resistance in that region of the country. Now, how is that going to contribute to the spread of this now that we are trying to find solution to these challenges? Is it that we are not educating these people enough on the essence of taking these vaccines, or what really is the challenge? I hear Dr. Ibrahim is back. Dr. Ibrahim, can you hear me now?
Yes, I can hear you.
Now, I was asking that you mentioned the matter of religion being a matter with regards to why we are not seeing, or why we are seeing these numbers in that part of the country. And I am saying that now that we are trying to resolve this matter, the government has put in place a task force, a desk, to addressing these issues, yet we are still witnessing vaccine hesitancy, vaccine resistance, and the matter of religion. How then do we come close to resolving these issues when we still have challenges like this that we have been witnessing over the years?
So I think religion is just a minor part, and I must commend the effort of religious leaders who are helping the vaccination program in Nigeria to sensitize people on the importance of vaccines. I think the major issues are misinformation. So there are a lot of rumors. I know with people having access to various means of communication, social media, and all that, there's a lot of misinformation spreading across the world, and people then pick up this misinformation, and it prevents them from getting vaccinated. They have those funny beliefs. So these are the critical things we need to deal with. And as you rightly said, we need to sensitize the public. We need to keep saying that vaccines are safe. They go through a rigorous process during development, and they are tested before they are made available. And even when they are brought into this country, NAFDAC also tests these vaccines to make sure they are safe. I'm vaccinated. I can see I'm healthy. My child is vaccinated. So it's important that we continue to sensitize the people that vaccines are safe. And we should not just stop speaking about this maybe via television. We should also go to these local communities, find out who are those influencers that can really influence them. What are those means of communication? So town criers, speaking during sermons, during prayers, using community women leaders and traditional religious leaders to kind of speak to these people, to our people, and emphasize that vaccines are important. And when you get vaccinated and you encourage members of your community to get vaccinated, you're protected from deadly diseases such as diphtheria. As you rightly said, diphtheria is very deadly. It could lead to even complications, heart complications, nerve complications that lead to paralysis. So it's important that people realize this. And in addition to vaccination, it's also important that people begin to protect themselves, right? Make sure that they are not coming in contact with wounds of infected people, and then avoid overcrowded areas, especially areas that are now known to have this outbreak of diphtheria, because these are other factors that can also lead to spread of diphtheria.